This is a wellbeing session. I know a lot of people have asked me by email in advance some really technical questions about things like HR, GMC registration, technical things about coming back to work, which I am not necessarily sure. I'm certainly not qualified to give an answer to them. I might be able to, in some cases, signpost people to the right place to get them. But actually, quite often in a lot of cases with these questions, there isn't an answer in the world. Like, how will GMC re-registration work? And where will I be placed next week? And that's why I've invited Caroline here to talk, because she's really good at helping guide us through this real massive uncertainty that all of us have as returners, because I'm a returner as well. There's a Q&A down at the bottom of your panel, and please feel free to ask any questions that you have, and we'll try and answer them at the end. We've got three wonderful assistants, Amy Manicum, who's a QI fellow in Thames Valley. No, we've got Amy Manicum, who's a clinical fellow in Thames Valley, Sarah Siddiqui, who is a national clinical fellow, same as me, for supported return to training. And we will have Anne Heath, who's the supported return to training manager in Thames Valley, and all of those people are here to help answer your questions and to help field any good ones. So there is a Q&A box down there that you can type questions in. I'm going to go ahead and do a proper introduction now, and we can get started. So welcome, all 302 of you. My name is Dr. Lizzie Townsend. I'm a National Clinical Fellow for Health Education England, and this year I've been working on the Supported Return to Training programme. So I'm out of programme to do that. I'm not working clinically at all, and before that I was on a year's maternity leave, so I've been out of clinical practice for 18 months now, and it looks like I'll be going back soon, which is a lot sooner than expected. So I'm in the same boat as UFIC, and I've also been working for quite a while now on the difficulties that trainees returning after a career break face. I'd like to start by saying that I know that all of you will have questions around registration, professional bodies, HR, employment, and so on. And we've all been told that the NHS needs us really urgently to solve this crisis, but we haven't been told how that's going to look, and that is a really hard thing. I know that the professional bodies and the government and the trusts are all working really hard to streamline the processes and pathways for us to come back, but obviously, necessarily, those discussions are happening completely out of our knowledge and control. So in the meantime, it feels like we're just adrift and we don't know what's going to happen. So you're aware this session's being recorded, and I hope to make it available through HE later so you can watch it again, and do be aware that this is a public space, and you can submit questions by typing into the Q&A just below. This is a wellbeing session. I have an expert on wellbeing here. It isn't going to be an HR session, and we're not going to get too far into the nitty-gritty of GMC registration or contracts. Many things are just simply unknown to anyone in the world at this point. And that's why I really wanted to put this webinar together today, so that we have a place to hold those uncertainties and maybe signpost to the small amount of information that we do have, and the things we can control, and the people who can help us. So I'm going to hand over now to the real expert in this, the one with the answer to no answers, which is Dr. Caroline Walker, who is a consultant psychiatrist and founder of The Joyful Doctor.
Oh, thank you so much. Welcome everybody. It's so wonderful to be here, not least because you just promoted me a grade. I actually left my training at ST6, so didn't get to consultant, but I am a psychiatrist working in the UK. So yeah, I'm Dr. Caroline Walker. I'm a UK trained psychiatrist and psychotherapist. And a couple of years ago, I founded The Joyful Doctor, which is an organisation all about the well-being of doctors and looking after doctors. And the reason I work in that field is because I've really struggled myself with my own well-being over the years. I've had problems with my own mental and physical health, and I've had a really kind of on-off love affair with medicine, having taken a couple of career breaks and come back in and done some different things for a time. So Although my current job isn't changing, well, it's not changing in terms of the job itself at the moment, I can really relate to some of the feelings that people are, experiencing with this kind of whole idea of, going back into clinical medicine. I can relate as well, just on a very personal level, to just the unbelievable situation that we're finding ourselves in. I really want to just say that these are extraordinary times, and they are unprecedented, and we don't have a rule book, and it is incredibly anxiety provoking for a lot of us, and I share in that too. Although my actual job itself isn't changing, everything around it is changing right now, and it feels to me like the world has shifted on its axis in under a week. And I'm hearing that from a lot of doctors at the moment, that it feels like we're in some sort of movie, or it's just surreal. We can't keep up, it's changing all the time. And I think we're seeing so many different, emotions coming out because of that, which are all completely normal and understandable. And I think it's really important. I'm so pleased that you've, been able to provide this space for those affected by this particular issue of returning, to kind of just think about what it feels like, to be put in that position. We were going to, I think, run this webinar quite informally. So, I'm going to talk a little bit to start with, just for a few minutes, about some of the things that I'm hearing from doctors out there at the moment around this issue of returning to work. Just hopefully so you can kind of feel that you're not alone. I mean, there's several hundred of you on this webinar alone at the moment. There were 15,000 of you that received that email from the GMC. You are absolutely not alone in going through this really quite unprecedented, quite strange, quite bewildering, frightening time. So I'm going to speak a little bit about the sorts of things that I've been seeing, and then, as I understand it, so our amazing panelists are going to field some of your questions to me, and we're going to kind of try and answer some of your specific questions. So please do use that Q&A down at the bottom as we go along, as things pop up that you'd like to have answered around your wellbeing. So what am I seeing? I mean, I think the whole COVID's obviously been around for a few months now in the world, but I think it's really only just full on hit the UK emotionally in the last week or so. And so I think where some doctors have been, perhaps some doctors out of work at the moment, have been thinking that, what would it be like if I got called back, or what would it, a lot of us are getting those sort of those kind of funny intrusive images that we can only really get from movies. So those ideas, that we're going to don our, cape and white coat and go off and save the world. And I've had those thoughts, as a psychiatrist, that I would be asked to go and, work in A&E or work in an intensive care type unit, or, to kind of man the front lines throughout these, this crisis. So many of us have been getting those thoughts for a while, but it wasn't really until this week, I think, that it absolutely full on hit home for people. And when that email landed in people's inboxes, I mean, I've just got a little shudder actually just thinking about what that must have felt like for you guys, because, we never want to get an email from the GMC, full stop, right? But that email, it wasn't just another email, was it? It was so laden with so many different emotions, and it would have generated so many different emotions in each and every one of you. And every single one of those is normal and okay. So for some of you, it kind of felt like, oh, well, I'm not going to go back to practice. That's just not going to happen. And it didn't, register too much. But even for those people, they were left with a real sense of kind of guilt, and a sense of wanting to help, a sense of wanting to kind of step up in this time of national need, because being a doctor isn't just a job for a lot of us. It's a part of who we are. It's an important part of our value system, to care for others and to step up when people are in need. And when we see suffering, we want to relieve it. So even for those doctors who didn't even consider coming back, when they got that email, they were still feeling those bits of guilt. And then there was, oh, sorry.
No, that's all right. I just, I'm noticing a lot of people asking what email. And obviously, a lot
Okay.
of us who are registered with the GMC but maybe aren't working clinically are even
Okay.
in the, I think it's an even more awkward position at the minute that we know we're going to be called back at some point. But
Right.
obviously, the GMC has had to, they have to register the unregistered before they can pull in all of these new registrants plus the old registrants who aren't working clinically. So
Got you. Yeah, absolutely. And actually, sorry, we should have started with that. That of course, everybody on this call and everybody thinking about returning to work at the moment has, I mean, there's so many different reasons.
we've had a couple of questions about people who are pregnant, who are really frightened. And obviously there's been some shifting kind of clinical information, but I understand that right now the information is that it's not high enough risk pregnancy alone in itself to keep you off work. So I think people are frightened by that, and I don't know how one would navigate that kind of fear.
Yeah, I'm really glad you brought this up, because there's a lot of women of childbearing age either wanting to get pregnant or already pregnant in the different stages of their pregnancy, or just about to give birth, or just have given birth. And this whole COVID situation is really incredibly emotionally challenging for those going through that. For those that are pregnant at the moment, to be thinking about coming back into this work at this time, I think the biggest fear I'm hearing from pregnant doctors at the moment is, am I going to put myself and my unborn baby at risk? I mean, that's what we're talking about. The bottom line is, we are human beings and we're absolutely biologically primed to protect, our babies, even from the moment of conception. So we feel that fear and anxiety anyway in a normal situation. I see doctors all the time that have that fear about just doing their normal day-to-day job. So to be facing the prospect of going back into clinical practice as a pregnant woman at this time of increased uncertainty, and that it's completely natural and normal that you would be feeling really, really quite worried about that. What I would say is that there is nobody out there that wants you to put yourself or your baby at risk. Okay, and there you can speak with occupational health. If you're under the practitioner health program, if you've got mental health problems as well, you can speak with them. But basically, there are people out there that can protect you in terms of the work that you're going to be doing. So if you're somebody that's got, say, you're pregnant, or you've got a health condition, or you've got other reasons, where maybe a mental health condition where you might be at increased vulnerability to some of the stuff that's going on out there, then we're going to be looking to put you in positions that are, more protected. We don't need everybody stepping into practice right now to go straight to the front lines and be in the really hot, red or dirty areas, whatever they're called. They're called different things in different places, but the COVID areas. What we're needing is a lot of people to help with, to fill some of the more kind of background, sort of everyday roles and jobs that perhaps safer ones. So you might get put, for example, into a telephone, a job where you're just working by telephone. So it's not actually increasing your risk at all. So please don't assume that you're going to just be put into the most risky environment ever. I think when we get, when there's uncertainty and we don't know where we're going to be put, our immediate thoughts and feelings go to the worst case scenario, right? We go, oh my God, I'm going to be put into this awful place where there's not going to be enough PPE and I'm going to expose myself and my baby. And that nobody is looking to do that. Yeah, we as a workforce, we are going to be protecting you as much as we possibly can, you and your baby, to be working in ways that are safe for you, just like we would do in ordinary practice. Yeah. Now we're all facing increased risk of being exposed to COVID, right? Because it's a virus that's out there in the population. So we can't kind of protect you from being exposed full stop, other than by fully isolating at this time. So of course, doing any kind of practice where you might say go have contact with people might put you at a slightly increased risk. But as I say, there's going to be people looking out for you. Get in touch with occupational health now. Start having that conversation with them now about which jobs you might be suitable for and which jobs you might not be. Because it's not just COVID. Remember, when you're pregnant, you have to think about all the other risk factors and things as well. So most women, most doctors, who get pregnant, as soon as they're willing to let their employer know about it, they'll have a risk assessment. That will still happen. Yeah. And so you will be supported to work in a safe way for you and for your baby. Yeah. I hope that is reassuring. And I know it's really hard because you might think, well, how do you know that? How do you know what they're going to ask me to do? Well, I can tell you that I work with doctors every day at the moment who are being asked to step up into roles that are not safe for them, and we're protecting them. And we're saying, no, actually, that's not okay. That's too many hours, or that's too much stress, or that's too much risk. So your individual situation will be taken into account by the people that are looking out for you.
There is I'd like to talk a little bit more about parental leave, because I see from the poll that quite a large portion of people are on parental leave.
Mm-hmm.
But I just noticed something from the chat about let's all be kind. And I wanted to talk about an experience that I had and maybe sort of talk about that, because different people obviously react to stress in different ways. And I made the mistake of going into a supermarket, and it was like a hellscape, but not because there wasn't food, because there was food, and there was a lot of people there, but because everyone had forgotten how to be kind. The poll, by the way, I see people asking where it is. The link is at the bottom of the screen there, I hope. But people had just forgotten how to be kind entirely, and they'd forgotten, you know, how to ask for permission, or how to. And I think that's quite a common response to this kind of stress, isn't it?
Yeah, absolutely. I mean, I don't think it's the fact that they've forgotten. I think they're just under immense stress and pressure. And when human beings, when we're under stress and pressure, we kind of lose our filters a little bit. And as doctors, we are really, really good at keeping those filters up, because we've been trained for years and years and years to be polite in the face of extraordinary distress and, you know, uncertainty and pain and fear. And that's our job, right? If you think about a typical A&E shift, or, you know, a junior doctor shift, you're constantly facing that kind of human pain, fear, upset, etc. And we are trained, and we learn how to maintain normal social etiquette and politeness, right? Whereas most people, like, you know, don't have that. So actually at these times it's really quite normal, quite human for people to, like, when they're put under immense pressure, to suddenly lose that ability to be kind. And so I think it's not that they've forgotten how to do it. I think it's just they're not able in that moment to access that kindness because they're scared. I mean, this is primarily, it comes across as anger or selfishness or, you know, something really horrible, doesn't it? But actually it's being driven by fear, because everyone's scared right now, you know. And when people get scared, they act in, you know, slightly different and irrational ways. So
yeah, I definitely have to bite back my worst person, try and remember to be a bit of a better person. I think it's hard with my family as well, because I have permission in a way to be my worst person at home, and I just have to not do that all of the time.
Totally. I snapped at my partner this week. I got a bit funny with one of my other family members. I sent a message that just came out totally wrong this week, because we're all under extreme pressure. And even as doctors, even though we're used to working under pressure, the kind of pressure we're seeing with COVID it's another level, you know. And we're not just experiencing it as individuals, as human beings, as pregnant women, or as new fathers, or as you know, elderly people that have just retired, and actually, or more elderly, I should say, not elderly. Sorry, don't want to offend anyone that's just retired, calling you elderly. But whoever you are, you know, we're all experiencing COVID and the impact it's having on our lives as human beings, not just as doctors. And then we're experiencing what it's doing to us as doctors as well. And you guys, the returners, are in this really, really tough place right now, because it's the unknown. It's the what's to come. And that's, in my experience so far, that's the harder bit, because when you start to actually get on with it, when you get your job, and you get your risk assessment, and you know that you're going to be okay, and you know where you are, and you know where you're going to park your car, and you know where your login is, and you know all of that stuff. It's really important for us to feel safe and secure and okay. When that starts to kick in and you're busy and you're helping people, you won't feel as anxious anymore. You know, it's not as hard. You'll be facing some other stuff that's going to be really quite hard, and I think some people are quite, you know, scared, quite you know, rightly about that. But the anxiety this phase is, I think, one of the hardest, because it's like we just don't know what's coming, and yet we're also sort of seeing what might be to come. So now we have, you know, 24-hour news cycle, we have social media, we've all got a smartphone, we've all got our, you know, tablets and our computers and our televisions, and we're constantly being exposed to what, you know, what is happening around the world, and some of the scary things, and some of the really, really quite tragic and really awful things, like hearing about colleagues who have died, and that. So it's really hard. You're kind of in this really stuck place between, I'm scared of what's to come, but I can kind of see what's going to come, but I don't know what's going to come. So it's, yeah. So I just really, again, I want to normalize that for you guys, that it's absolutely how you're supposed to be feeling at the moment. And there are things that we can do to help ourselves through this time, to make it as, hopefully pass as easily as possible for you. You're not alone.
There was two groups of people who are posting in a Q&A who I wanted to kind of cover. Both of them have in common that they might have a reason why they don't want to go back. Well, everyone has a reason that they don't want to go back. I mean, a really strong pull. So the first one I wanted to cover, just from a statutory point of view, is parental leave. I give lectures on parental leave, but I'm not an HR expert, and I really feel very strongly that if you are a member of a union, you should take employment advice from the BMA on this. But if you're on maternity leave, as the law stands at the moment, you can't be asked even to leave it. So please don't let anyone ask you to come back. You get one lot of parental leave per child, and you can't get it back if you terminate it. And absolutely, I've spoken to trainees and other doctors recently who are considering terminating the maternity leave, and that might be the best choice for them. But also a lot of people who are really worried that they feel like this guilt, this sense of duty, which I guess is what we all said in med school interview. You know, we all feel that in this duty, isn't it? But I'll let Caroline talk about the emotional side, but just from a statutory side of it, you absolutely cannot be asked to end your maternity leave early. I'm going to post a link to a Google document which is collecting kind of information for returners, and in that Google document, which is bit.ly/covid-returners, in that document there's a little bit about specifically parental leave rights, and although, as I say, I'm not an HR person, so I can't guarantee it, but those are your rights as I understand them. And then there's also people, you know, talking when they've got older children that they really don't want to leave, they've stayed home for childcare reasons, and people who've left maybe as well because they were having a crappy old time. People who faced bullying, people who faced, you know, really difficult clinical environments, that they're, so all of those people, you know, are feeling like they really don't want to do this, but they might.
And I guess it's what I was starting off saying, and apologies for how we kind of got a bit muddled at the beginning of this webinar, but I was starting by sort of saying that this invitation to come back has kind of arrived in one form or another for different people at different times, and a lot of people are very conflicted about it, really, and it's so normal, and it's okay, you know. It's okay to not want to come back. It's okay to want to come back. It's okay to not be sure. It's okay to part of you to be so desperate to want to come back, and another part of you to be absolutely aversive to it and like, I can't. So it's okay, wherever you are on that spectrum, it's absolutely okay. We do not expect every single doctor that was ever trained out there in the world to come back. You know, what we want is those that feel able to, and who can, and who is the right decision for, to come back if they can, yeah, and we'll support them through that. But we also want those who it isn't the right time for to not. And it's really important that you do that, because this isn't just about the next few weeks, you know. We are going to need some of you who don't want to come back right now, but you do want to come back and help. Now might not be the right time. Yeah, it might be that you're on parental leave, for example, and the right thing might be for you to finish that and then come back, or to finish that piece of research, or to finish whatever it is that you're doing. It doesn't matter what the reason is, they're all equally valid. It's okay. We're going to need doctors to come back in at lots and lots of different points in the future. You know, we're going to need rested, happy, you know, contented, relatively contented, unstressed, unburnt out doctors to come in and help when, you know, the doctors that are there at the moment are going to start to struggle and need to step back. So you might be someone that's off for a reason, don't want to come back right now, but want to come back in the future. Please just do that. And please, you might feel a sense of guilt because you want to help right now when the crisis is worse, but we actually need you later down the line. We need you to do it at a time that's right for you. For those of you that don't want to come back for whatever reason, again, incredibly normal and natural, and I completely understand, and I think a lot of us do. I think there's a lot of doctors out there right now working that are considering their future in medicine, actually, and this whole situation will probably get them to consider whether they stay or not, you know, longer term. But being a doctor is not easy. It's an incredibly challenging, high stress, emotionally draining thing to do with your life. So it's not like we're asking you to come and you know, volunteer to hand out something at a I don't know, a place that needs to hand out things. I've lost not a very good way of putting that, but we're asking people to come back and do something that's absolutely phenomenally, like, potentially quite challenging and difficult. So please, if you were someone that, say, were, you know, burnt out and left because of that, or you were bullied, or you have like a really strong sense that it is absolutely not right for you, then please give yourself permission not to come back right now. You know, you might change your mind in the future, you might not, it doesn't matter. But right now, the last thing we need is a load of doctors who really don't want to be here and can't be here for whatever reason to be here, because this is not just your everyday situation. You know, it's going to be quite tough. So I think if you're coming back, I think it needs to be the right decision for you. And if you're not, then please, you might feel guilty. I think it's quite natural to feel guilty, because we feel guilty because we care. You know, if we didn't care what was going on, if we didn't want to help, if we didn't see people suffering, we wouldn't feel guilty. We wouldn't, you know, but so it's really normal to feel the guilt. I don't think the guilt's going to kind of disappear overnight. I think that will go with time. But you haven't done anything wrong. I think it's really important to know that and to hear that from your colleagues. Yeah, that we respect you. You are an absolutely valuable human being, whether you're a doctor or not. And you must make the right decision for you at this time.
Yeah. And I think, yeah, I think that's true of parental leave, of burnout, of people who've left for all sorts of reasons, I think. You know, I'm a carer for a disabled adult myself, and I read a letter in a newspaper during the junior doctor strike, which has stayed with me since, which is, you know, if we as doctors have a caring responsibility for someone, and we can't discharge that, then on what basis can we care for patients if our first caring responsibility is not fulfilled? And I think if there's someone who's sat there going, oh, maybe I'm feeling really guilty that I can't leave my baby or leave my person you have caring responsibilities for, you know, that for what? For someone else you have lesser caring responsibilities for, i.e. a patient. It's not a question, really.
And I would say it's actually okay, and this is something doctors struggle with, it's okay to put yourself first. And that is something that and I struggle with this, and most doctors, I've met very few doctors who don't struggle with it. The ones who don't probably psychopaths. And it, you know, it seriously, it's such an inherent common thing about being a doctor, that we put other people first. You were really, really good at that. And we find it very hard to put ourselves first, but we have to, because if we don't put ourselves first, if we don't put like our own oxygen mask on first, if we don't fill up our jug first before we fill up other people's, we're no good to anybody. You know, I have bipolar disorder, I have addictions. If I don't take care of myself, if I don't get enough sleep, if I don't you know, eat and drink and get enough support, if I don't take the medication I need to take, if I don't monitor my workload and make sure I'm not doing work I really, you know, love and enjoy and is rewarding and not, you know, stressing me out too much, I'm going to get sick. Yeah. Right? I'm going to get unwell, and I'm not going to be able to help anybody. So I've learned through bitter experience that you have to put yourself first. It's not about being selfish, actually. It's about helping other people. You know, if you can put yourself first and look after yourself and do the right thing for you right now, for you and for your family, for your loved ones, you know, for those people that are most important to you in your life, for those you've got caring responsibilities for, you will be a better doctor for it in the longer run. And you will help more people, whether you work in medicine or not. You know, you're gonna, you know, just please, know that you're not alone in feeling that way, and it's okay to put yourself first.
So I've got a really great question here from Lisa Kearney. She said, in some ways, this is an opportunity to come back to leave our past concerns behind. How would you advise we turn this into an opportunity? Are there things we could do or things others could do to help make it a positive experience?
Yeah, great question. Absolutely. I mean, in every crisis, there is opportunity, isn't there? In every trauma, there's room for traumatic growth. And I think we're going to see a lot of that actually through this. You know, a lot of people able to really take the time to reflect on what's important, to reassess some stuff that was maybe going on in their lives automatically that they weren't looking at. That, you know, something like this, it really comes along, it stops you in your tracks, doesn't it? And it makes you go, oh, okay, life is short, and we never know what's around the corner, and let's, you know, what's important to me. And yeah, so I think it's a real opportunity for a lot of people in terms of like opportunity of returning into work. Absolutely. There's never been a better time, I think, to jig your relationship to medicine, because right now there's actually this curiously lovely thing happening where for the first time in a long time in the NHS, you can kind of just do the job you want to do without too much of the kind of red tapey, paperworky nonsense stuff getting in the way, because people are all pulling together to go, what needs to get done? Let's do it. Let's help as many people as possible. So I think a lot of doctors are actually going to enjoy coming back in and working in the NHS in that way. You know, it feels very different to how it felt even just a week ago, but certainly a few months ago. And this isn't forever. It's really important to remember that you're not necessarily signing your life over for life, you know, for the next 5, 10, 15 years. I think it's important you realize that if you do come back, this will impact on you, and it may have lasting impact. So you may experience or go through experiences that stay with you and change you in some way as a person. I think that's a reasonable expectation, because it's going to be a tough time, even if you're not facing the really tough sort of, you know, even if you're not right on the front line, seeing the worst of the worst things happen. Even those of us kind of a few steps back are still going to be feeling and experiencing and hearing and supporting friends and colleagues through pretty tough things. So bear in mind, if you're choosing to come back, that this is going to be quite a profound experience, and it could change you, but absolutely it could change things for the better. Mm. This could open your eyes to a different way of being a doctor. This could make you fall in love with medicine again. This could open your eyes to a totally different specialty that you never, you know, considered before, and actually really love. And, you know, I think there's going to be limitless ways that this could be a really positive thing for people. Yeah. It's just very hard to see that right now, isn't it? When we're in this kind of phase where people are just not, there's so much uncertainty and we don't know what it's going to look like. But it doesn't mean that it's going to be bad.
Yeah, I mean, there's a few questions I can see people asking, kind of more technical things. Who will support me? What if my ALS is expired? Will I have to work in a certain area that I haven't worked before? And oh God, I wish I could give that answer, because if I could give that answer to you guys, it would mean that I had the answer for me, for my return to work, and maybe also had the answer to various things that no one knows, like about epidemiology of this disease, which we don't understand. And I know that at the moment that these are not things that you are the first person to think of. You know, I put this webinar together 3 days ago, and we have hundreds of people who've signed up. Got 274 people listening right now, and you are not the first person to have raised these questions, and I'm obviously going to pass the questions that you've given me on to HEE, and they will pass them on to the GMC, and they are already thinking about these things, guys.
Can I say a point about the who's going to support you? Is
yeah.
Is that all right? Because I think I could say some stuff about that, if that might be helpful. And I mean, the short answer is everybody. I mean, I cannot tell you, and I feel quite emotional thinking about it actually, how many thousands of people there are out there right now thinking about supporting you guys. At individual level, I've been getting emails and I've been having phone calls with so many people in individual departments around the country going, how can we support our staff? How can we support the people coming back? How can we, you know, there are so many people out there that are on the ground now helping and supporting doctors. There's also organisationally a lot going on in the background of big organisations getting together to talk to each other about how we can provide you with support in the most efficient, most helpful way going forward. So, and there's help there now for you if you're struggling. So I will signpost you to those as well. But my take home message here is lots and lots of people are going to support you. Okay. I don't think there's a doctor in this country that wouldn't recognise you coming back is a huge thing to do. And there isn't a doctor in this country that wouldn't, I don't think, lay down, you know, and give you everything they could to support you in this. So we are in this together. I'm here for the duration. Your support team are here for the duration. There are dozens of organisations talking to each other about how to provide, like, you know, immediate telephone support, and one-to-one support sessions, facilitated group sessions, coming into the workplace to support people, supporting people in the immediate term, the like short term, and then the medium to longer term as well. You know, there are literally hundreds and thousands of us out there working on how we're going to support you guys. So it may feel like you don't know who that is right now and who to go to, but I will signpost you to a couple of places that you can go to now if you're struggling.
Yeah, go ahead, Caroline.
Can I just do that now? Okay.
Yeah, do it now.
So it's evolving all the time, and we'll keep you updated. So watch this space. But at the moment, if you're someone who's feeling like just a little bit rattled by this whole thing, and you're just like a bit anxious, a bit stressed, a bit worried, a bit, you know, oh, I don't know what to do, and you just want a space to talk with someone, then we're signposting people to BMA Wellbeing Service. Now, they are not just for BMA members. Any doctor can ring them up. There's a 24/7 phone line. So you ring them up, and they will then put you in touch with somebody to speak to you one-to-one. So you can just talk. You can have a safe space, confidential space to just, you know, download whatever it is that's going on for you and get the support you need. So I'll be talking to someone like me, okay? Just, yeah. So if you're sort of in that kind of, I'm just struggling a bit and I just want a safe space to talk, then BMA Wellbeing, Google it. We can put the links in when we send things around. If you think that you're struggling with a slightly sort of more like a mental health problem, so if you think you might have an anxiety disorder or depression or some PTSD type stuff going on, or some grief, like really profound grief, or you're struggling with your mental and emotional well-being in a way that is a bit more profound and it's starting to impact on your ability to sort of function day to day, then I would signpost you in England to the NHS Practitioner Health. So you can self-refer again for free and confidential support to them. For those outside of England, we're looking at what we can do for people. But if you ping an email, you can access BMA Wellbeing wherever you are. So do that. There's also all the other stuff that we can access, that any other person can access, like the Samaritans, etc. So please, know that there are support services out there. My website, joyfuldoctor.com, has a list of about 40 or 50 free support resources for doctors. So there's stuff out there, yeah. But the two main ones we're signposting at the moment are the BMA Wellbeing Service, and for those in England, any doctor in England to self-refer to NHS practitioner health.
Yeah, I'd also really recommend the professional support units. And they have slightly different names in different areas, but they're deanery or local office based, and alongside a lot of support that they can give you, and they can often give you. I got some free CBT from them in my area, but they can also offer career development coaching, which is about turning this into a positive experience. And some of you who are maybe thinking about whether to come back, whether that's a good choice for you, some career coaching may well be able to help with negotiating those decisions. And that's certainly free for trainees.
Again, there's lots of people working out how we can get doctors more access to some free coaching. We offer some through the Joyful Doctor if you want to get in touch. But there's lots of us thinking about how we could, because I think it's a really important time actually for doctors. Never has there been a more important time for us to think about, what do we want? Because we're all, if you think about it, we're all trained to be incredibly versatile, which is why they're managing to move us all around into different places and get us to do different things. I've totally lost my train of thought. Sorry, that happens.
We want more coaching. Coaching.
Yes, this is the right time. I think we sometimes as doctors, we get really blinkered. We think we're only trained to do one thing. I'm only a psychiatrist, I can only do that. Or I'm only an ophthalmologist, or I'm only this. I'm only a GP. No, you are in the top 1% of the world in terms of your potential and your transferable skills and your intelligence and all of that stuff. So you can pretty much do anything in the world you want to do right now. So some coaching can be really helpful to help you to get in touch with, well, what do I want? Because you do have choice here. And I think there's a real issue here around autonomy and choice, isn't there? Because this feels as if it's something that's being done to us as a profession. You're being called back in, drafted, like a compulsory draft, but that is not what's happening. This is a voluntary opportunity to step up if you want to and do something different for a while. Yeah.
Angeli Pereira's reminded me of something which I wanted to mention, which is the National Health Supporters, which is a group of, it's a sort of loose collective of medical students, because they've all been put on furlough from their med schools. And a lot of them are kind of volunteering because they're DBS checked and they have some experience that they're offering to help with informal childcare, or going and getting shopping, or walking your pigeon, or whatever it is. And they're a really great group as well. I mean, there's a lot.
So I just say to people all the time in my normal day-to-day job with doctors, just keep asking for what you need. And if you're not getting it, just keep asking someone else, and just keep asking and because you will get it, because the support is there. We'll be sending you as much as we possibly can in terms of links and resources and things. And I want to just flag as well some of the fantastic online support stuff that's out there at the moment. Some of the Facebook groups are phenomenal resources for support. And I know a lot of us are struggling with our information flow and being on social media a bit too much and finding it a bit overwhelming. But there are some little pockets where you can just get such lovely, amazing support, and you can actually go offline and talk to people one-to-one by phone or like this, using virtual apps and stuff. So things like Tea and Empathy, Facebook.
Brilliant.
Amazing. I mean, that was, yeah, that was set up after we sadly lost Rose Polge, the doctor that sadly took her life just in the time of the junior doctor's contract dispute. But it's a place where people are really just very, very positively supportive of each other. There's also, I've just set up with a couple of other people in the wellbeing space, a coronavirus wellbeing support group for doctors on Facebook. So if you search that, please join that. There's going to be a lot of really positive, helpful, supportive stuff in there. So I think it's about selectively picking the bits that are going to be helpful, and trying to minimize how much we look at all the stuff that isn't, you know, that's winding up our anxiety and making us feel worse.
It's so difficult, isn't it? I've
Yeah.
had to start leaving my telephone in another room,
Yeah.
because everything is work. Like, it used to be that I was compartmentalized and Facebook didn't have any work on it, but now Facebook is all work as well.
Yeah. I'm recommending that doctors get really boundaried quite quickly, like do it now, because if you don't get this habit in place now, it'd be hard to do it when you get more busy and distracted. And we tend to, when we're busy and stressed and distracted, like you were saying in the supermarket, we tend to behave or be on our phones more. So start to introduce a bit of boundaries around your time online. So I'm aiming at 10 minutes twice a day. I am managing that on some days and it's brilliant. Other days I get sucked in just like everybody else does. You know, this morning I woke up a bit early and I was like, oh, I'll just have a little look on Facebook, you know. It's really easy. So let's normalize that, right? We're human beings. These gadgets are designed to kind of pull us in. So we're working, you know, we're fighting quite hard to not, you know, to resist that. I think it's just realizing you are in control. We are in control of our own, how we interact with the news and the information flow. You're going to find out what you need to know. Yeah. You know, we don't need to be looking every 5 seconds. The information will get through. It can't help but get through at the moment because there's so much of it that even if you didn't watch the news for a day, you'd probably still, you know, find out what you needed to know. So yeah.
Move your phone chargers off your beds. It's not fire safety, and it's not sleep hygiene, and you recommend it to patients and you still have it there.
Yeah, I'm about to go back to using my old-fashioned alarm clock next to my bed, so that it's not the first thing I pick up in the morning and the last thing I look at night, because it has become that again, and I think it has for a lot of people. So yeah. Plus
it's a foamite now, so you know it's dirty. You should leave it downstairs. I wanted to, we've got a really great question about making some space at work, and I'd really like to end on that one, but I would feel bad if I didn't address this technical question. Again, it's about parental leave. People are asking about the annual leave part of your parental leave, because obviously you have a statutory right to the parental leave part. Annual leave has to be agreed, as I understand it, with your employer, and I think therefore that they would potentially be able to curtail it, but it would be something that would have to happen under discussion with you. And ultimately, I think you really need to get proper employment advice if you're feeling pressure from your from your employer and you're on parental leave, because it's very easy for those sorts of things to be to veer into the discriminatory, and they really ought to be very careful about what pressure they put on you as a parent, as a new parent. So, but yes, but I really wanted to return and to end on how we can, when we're in the workplace, how can we make space for ourselves to not lose it in the middle of the shop floor?
Yeah, great question. And actually, I think we need these tools now, don't we? I mean, whether we're in the workplace or not, I think a lot of us are feeling quite on the edge, and you know, how can we manage all these extreme emotions and not losing it? And so first of all, I just want to normalize that we probably are all going to lose it at some point, and that's absolutely okay. Like, I had a little cry at the weekend. I've no doubt that in the weeks and months to come, I'm going to have some moments where I'm really feeling like on, the edge. So, and I think we need it's going back to that kindness idea. We need to hold that space for each other as colleagues, that it's okay that we're going to struggle, we're going to get bad days. if you're in a situation where you're kind of feeling like the tension's rising and you feel like I'm about to lose it and you've got enough time to do something about it, then I use a little technique where I kind of imagine just, okay, I notice that I'm feeling it, and I just pop that feeling in a little box, just pop the lid on it and just pop it to one side, finish what it is I'm doing. But the important thing is that I remember that box is there, and I take it with me and I go and I open it somewhere else and I look at it. So maybe, you know, maybe I'll take myself off to the loo for a few minutes, or I have a coffee break later in the day, or maybe later when I get home, I get that little box out again and I go, okay, what was that? What was going on there? Because I think if we use that technique too often, if we try and sort of push our feelings down, or we try to not be feeling overwhelmed with it all the time, then it's a recipe for disaster, because we just get unwell and we just don't function very well, and it's probably going to come out sideways at a time when we don't want it to. So it's a good temporary strategy though, is just notice, oh, I'm about to cry, okay, oh, okay, pull myself together for a second, but I'm going to look at that later. You come back to it. Yeah, if you're if that's happening a lot, if you're really on that edge all the time and you're having to like really hold it together a lot, or you're always crying at work several times a day or over a few days or over a few, really try to reach out and speak to somebody and get some support, because it may be that you've just sort of reached your natural limit at that time, and you just need to take a little step back, and that's okay. You know, no one's expecting you to come in and do this job at like 100 million% in this ridiculously unprecedented situation and cope with it brilliantly all the time without struggling a bit. And maybe sometimes you might need a day off, you know, maybe sometimes you might need to step back for a bit longer. That's okay. So I think if it's happening a lot and you're not able to kind of control it in the moments and it's getting a bit, I think it's okay to cry at work. Can I just say that? Like, it is okay. In fact, I contributed to an article in the BMJ about this just last year, that it is okay to struggle. It's okay to have a little moment, you know, where you just lose it a bit. If it's happening a lot and you feel like, oh my, this is not right, I'm really not able to really function here, but then please get some help. Please come and, you know, drop me an email, you know, caroline@joyfuldaughters.com. I'd be happy to signpost you, or self-refer yourself to the BMA Wellbeing Service or Practitioner Health, you know, if you're in England. Just, yeah, get some help. Thinking more about space generally, things that are helping doctors in COVID at the moment are really simple interventions, like 5-minute coffee breaks, 5-minute check-ins at the beginning and end of shifts. 5 minutes, like, not, don't expect yourself to go off for a half an hour leisurely lunch and stroll around the park. You might, if you're lucky, get to do that, but you know, just these little tiny moments where you connect with each other. So creating space in little moments, I think, is going to be how we get through the next few weeks and months. Allowing yourself to take a mental time out, you know, use some imagery. Think about the last time you went on holiday. Think about the last lovely meal you had, or, you know, bring your mind, give yourself a mental break, even if you can't take a break away from the environment. Let's say you're in PPE and you don't want to get all, you know, un-PPE'd, and take a mental break. Close your eyes, you know, for a few minutes and just remember a different time, you know, or look forward to a time when this isn't going to be where you are. So it's about creating space for yourself internally and with each other. I think the most important thing is to connect and not do this on your own. So little coffee breaks, little check-ins, a little message to your friend when you can, you know, support one another. Don't do this on your own, and create space wherever you can.
That's brilliant. Thank you so much, Caroline, and thank you to our 220 attendees who are still with us. I'm really grateful for you all coming here and being present and sharing your questions with each other and with me. But in the meantime, in this big uncertain question marky time, I feel a bit better. I hope everyone else feels a bit better. And thank you so much, Caroline.
My pleasure. Thank you for inviting me, and thank you so much for coming along, everybody. Please do, yeah, just know that you're not alone. We are there for you. We're doing a lot of these webinars and videos, and so please let us know. Get in touch and let us know what you want to hear, what would be helpful, because we want to know what's going to help you most at this time, and we're here for you.
You're right, come on, we will get through this.
We
It's true.
will. We're going to get through this. We are getting through this together. We are. Yeah.
Yeah. So thank you, everyone.